Hello, a very good evening to all of you. Today we are going to discuss the case note of Miss Olivia Hawthorne. She is a patient at your practice where you are a nurse, and she has come to have her intrauterine device removed. So she came for a specific purpose, that's for IUD removal. So let us see the task. What we have to do here is using the information in the case note, you are going to write a letter of referral, a referral letter to Dr. Miriam Shaw, consultant obstetrician, Royal Hospital, Luton. Now, this is what we need to understand. We are writing a referral letter to Dr. Miriam Shaw. So let us see what the case is in detail. The name of the client is Miss Olivia Hawthorne, and we don't have any information about today's date, so we can just assume. If you assume this as the date, today's date, then also we'll be having problems because you are right now in a different year. So I cannot write this year too. So what I have to do is that I can go with today's date because it's not given here. Just go ahead with today's date as it is mentioned there. So let us go ahead with the date of birth. So date of birth is what we need to say instead of age. So as we are not going to calculate the age because you know that the date today is different, tomorrow's date will be different. So if you calculate the day age, it will be confusing, really confusing, because you don't know the exact date which you are writing right now. So you don't calculate the age. Instead of this thing, you are going to write the date of birth. That's pretty convenient for the candidate. Now we have a social background, which is not important to the current situation. Married and 2 sons. Okay, we are going to mention about the delivery, but we don't need it as a social background. We are not going to write what's her profession and what she does and what's her habits and diet preferences. It's not relevant to the situation because you are not going to write something relevant to that. You're writing to the obstetrician. So we do have a specific purpose for our writing. So we have to skip all these things. And Parkinson's disease is something which is not related to the current condition. So we have to skip that too. Again, we have 2 live children. So we are going to write about that. Now we don't want this proximal DVT because it's not related to this thing. So we can say iron deficiency anemia if you want, but I don't think that is relevant to the present situation because it happened long ago, almost 10 years ago. So, right now she might be taking medications for this. Right now, you're going to write about a specific condition, so it's not that much relevant. If you want to include, you can write it, but I don't see that it's too much relevant here because we need to focus on the condition and the needs. Now, 2009, we had menorrhagia and dysmenorrhea, third degree perineal tear, elective cesarean section. So this is something which we are going to mention in brief. So as she's having an iron deficiency anemia, she is taking ferrous sulfate. So we don't need to mention that. That's a reason why I have told that it's not necessary, because this is managed with this thing. So it's not a serious condition right now. Now, the reason for the presentation: the removal of intrauterine device is currently ineffective for menorrhagia and dysmenorrhea. So now she finds that the intrauterine device is not helping her to stop her complications. So she was advised for the device removal, and this is the reason for her presentation right now. Now we have to go in detail with the treatment record. So we don't need this thing. No. Yes, we need this thing. So menorrhagia, dysmenorrhea, she has had Seracet. Now this is also important. This is the stoppage of the medication for the consumption of first child. Now, after that, we have worsening symptoms, representation of the symptom. So we have another medicine. So that too was ceased. Menorrhagia returns after a couple of years, for which Mirena coil was inserted. The condition improved, but you have since the insertion of the intrauterine device, she had experienced about frequent vaginal thrush. That's about 5 times. And she was treated with a canesten. And after the insertion of the intrauterine device in 2015, she had an improvement in her condition, but after 4 years, she had another relapse. Spotting, menorrhagia, dysmenorrhea, increased hairiness, greasiness of skin. So therefore, you have the nurses prescribe the intrauterine device removal. And today, the removal of IUD was unsuccessful. Attempted for 15 minutes, unable to locate springs. So we have made the provisional diagnosis that it might have fallen out, or it might have shifted to another place. So we are referring to an expert obstetrician for further investigation, along with an ultrasound to manage her condition. So we have understood what to do here. As far as we are not going to write, it's not given today's date, you are not going to write today's date, you just write today's date here. Dr. Miriam Shah, consultant obstetrician, Royal Hospital, Lowtown. Dear Dr. Shah, the first name, the surname. Reference Miss Olivia Hawthorne and date of birth 79, 1st April 79. Yeah, okay, 79. I'm writing to refer Miss Olivia Hawthorne, who requires further assessment and specialized diagnostic procedures at your facility. So you are presenting the name of the client, Miss Olivia Hawthorne. And what she requires further assessment. We have made some assessment. Further assessment is needed. Further assessment, okay? She requires further investigation. And specialized diagnostic procedure. Here we are going to say something about ultrasound and something else. Specialized diagnostic procedures at your facilities. So you are an obstetrician, so you might have specialized diagnostic procedures there, and this might include, this should include ultrasound. So many students, they write ultrasound here. So I have kept it for the last, and that's why I have given specialized diagnostic procedures. It includes ultrasound. It includes, if any other procedures are there, it can include that, because you know that it goes with a further investigation. Further investigation and further assessment, it means you have to go ahead with specialized procedures, which we can now carry out here. It can be done by an obstetrician at her a specialized facilities or specialized diagnostic procedures. So if you're not convinced with specialized diagnostic procedures, you can just write ultrasound. So there is no confusion. If you want to write ultrasound as it is, you can write out ultrasound there. So the reason why I have written specialized diagnostic procedures here is to mention ultrasound separately at the end. Here I have mentioned ultrasound here. So it would be a repetition. So that's the reason why I have presented specialized diagnostic procedures here. Now, what's the condition? She's suspected to have an intrauterine device shift or fall. So what is she suspected of? She's suspected to have an intrauterine device. Okay, I can make a small correction. She's suspected of. She's suspected of an intrauterine shift or fall. Okay, so now the purpose is brief, it's very simple, and it is understandable, and this is written in a formal style. So what are the ingredients of the purpose here? The full name of the client, the requirement, and the condition. Now, if I move further, I have to say something about the medical condition which has led to the intrauterine device insertion, and later what has led to its removal. So this is what I have to say in the first part. So why you are not presenting today's condition or present condition, the most recent history is not mentioned here. The reason for that is just because you are focusing on intrauterine device removal. So we need to say how this occurred. What made the medical team to insert this coil. For what reason? So we can say that treatment was given first, treatment was given second, still the problem was persisting. So that is the reason why the intrauterine device was inserted. So that history I need to present. That is the first paragraph. So let us go ahead and see what is there. Miss Hawthorne was first diagnosed with menorrhagia and dysmenorrhea in 2009 and was treated with Seracid. Now, we have to see the word first, very important here, because she had these problems multiple times. So this was first diagnosed in the year 2009, and the treatment was Seracid. So it's a trade name we have mentioned in capital. The drug name is written in capital. In order to conceive her first child, so we have to understand a phrase for what she had stopped the medication. In order to conceive her first child in 2009, the medication was ceased. So the medication was ceased for what? For conceiving her first child. And when it happened is that in 2011. So the problem occurred in 2009. The treated was treated in about 2 years. She wanted to conceive her first child. So the medication was ceased. In the subsequent year, so 2011, 2012, so the connection is clear. The aforementioned problems reappeared. And was worse than before. So the aforementioned problems reappeared and was worse than before. So, or else we would have gone with Seracid. So it was worse than before. So for which she was prescribed with the combined pill Silest. So up to that, the history is clear. This too, what is this? The combined pill Silest was stopped for her next pregnancy in 2013. So in 2013, she planned the second child. After a gap of 2 years, menorrhagia returned with menstrual cycle, and consecutively, Mirena coil was inserted. So let us see there once again. Okay. So it returned. Yes, that's clear. Menorrhagia returned with menstrual cycle and consecutively Mirena coil. We have written that in bracket IUD because we have already mentioned the full form in the purpose paragraph. Here we have said intrauterine device, intrauterine device. So we don't need to mention every time that's intrauterine device. So we can say it is an IUD in brackets. You can use brackets. We use the name Mirena coil. And what is that? IUD, it's mentioned in bracket. It was inserted. She had vaginal thrush multiple times after the insertion, for which she was treated with canesten. So since the coil was inserted multiple times, you can see that 5 times or something there in the case not. So you can say that multiple times. And this was treated with canesten. Again, we use the capital letter because these are all the trade names. Now, after a period of 4 years, after a period of 4 years, in April 2019, Miss Hawthorne presented. So in April 2019, she presented with menstrual spotting, menorrhagia, dysmenorrhea, hairiness, greasiness of the skin. Now, she presented with menstrual spotting, menorrhagia, dysmenorrhea, increased hairiness and greasiness of the skin. Therefore, she was advised for the intrauterine device removal. You can say IUD removal, which was unsuccessful today. Today, the date is not, the date is mentioned here, 6. Okay, so I think 6 April, okay. On so therefore, she was advised for an intrauterine device removal. Which was unsuccessful on 6 April 2019 because the strings of the device were unable to locate. So let us go for a small editing here. Therefore, she was advised for an intrauterine device removal. On 6 April 2019, attempts were made for the removal, the IUD removal. So you can say IUD removal, which was unsuccessful because the strings, its strings were unable to locate. So on 6 April 2019, attempts were made for IUD removal. Where it was made? Yeah, at our facility. which was unsuccessful because its strings were unable to locate. Okay. So we had made another editing here because its strings were hardly located. Hardly means not located. Yeah. It would be appreciated if you could assess Miss Hawthorne's condition. So good, you have to assess the condition of Mrs. Hawthorne and conduct an ultrasound for further management. So right now, she has to remove her IUD. Its strings has to be located, and this can be done by an ultrasound. So further management can be done only when she is assessed. Further management can be done only when the strings are located. So she is being sent to you. So it would be appreciated if you could attend Miss Hawthorne and conduct an ultrasound for further management. That's better. Please note, her pregnancy test was negative. Yes, her pregnancy test negative. Should you have any further queries, please do not hesitate to contact me. You're sincerely registered nurse. Now, the matter is clear. We have completed the letter. The body of the letter goes around 209 words. Because we have just expanded somewhere, we could have made it under 200 words. So I think the matter is clear. The purpose. After that, what has led to the issue. Now, what is her condition right now? What you are expected to do. So each paragraph has a specific motive. The first paragraph, which is highlighted in the blue, gives you an idea that what has led to the problem. The second paragraph, which is highlighted in yellow, shows the current problem. The third paragraph, which is highlighted in blue, that is the requirement, what the obstetrician has to take care about Ms. Hawthorne. And that is the end of our explanation here. Thank you. Have a nice day.